It was painful.
It was excruciating. It was excruciatingly painful, that's why. But hopefully our discussion tonight will relieve the pain. So here's the question. I'll start out with the question, and then we'll work our way through. I'll give you what I think is the standard answer, what I thought the answer would be, and then I'll walk you through a little bit of research that I did that I think might lead us to a possible different conclusion. So the question is, let's say someone has chronic debilitating pain, but it's pain that's not necessarily something that they are dying from. It's not that they have a terminal illness that's killing them and their body is, falling apart. They have some kind of a chronic pain problem and they just are in horrible pain. So when they're treated for their pain, it's not like they're seeking a cure for their pain, they're seeking pain management, right? Not to cure the underlying symptom. So the question would be, how do we treat that pain in halacha? Could a doctor, for example, let's say a doctor has a patient who is treated by them only, and they have a patient who needs to see them on Shabbos. Normally, can a doctor treat a patient on Shabbos? Of course, if the patient, we'll talk about the specifics, but normally if a patient is treated on Shabbos by a doctor, if in certain types of illnesses, it fall into that category? Does pain fit into that category? Can a doctor drive to see a patient on Shabbos or violate a Torah prohibition to care for a patient who's suffering from chronic pain? That's the question. Okay, so what I want to do is walk you through the sugya, so to speak, and I think there's going to be an obvious answer, but then I'm going to challenge us a little bit once we get to the obvious answer and see if we could go somewhere else with it. Okay, so what we have to understand first is some sort of basic background about pain, about halacha and treating patients. So let's just kind of walk through some of the sources. Some of them we're going to come back to. Here's the general principles. Principle number 1, at the top of page 1, is Mishiyesh lo choli shel sakana. If someone is dangerously ill, mitzvah lechalal alav es Shabbos. It's a mitzvah to violate Shabbos for them. We do whatever we can to save their life. Right? Someone is life-threatening danger. V'hazaris hareze meshubach. And it's actually the faster you are to help them, the better it is. V'hashoel, and if you ask a question, hareze shofech damim. That's actually can be akin to murder by asking a question, because you're taking time away from helping the person, right? I don't know, maybe it's inappropriate, but some, like I've heard a number of rabbanim say that when a rabbi moves to a community, this is the first halacha they're supposed to teach their congregants. And I remember I was once with a rabbi, and I was just listening to the rabbi being asked questions, and someone said to him, Rabbi, I have a question. It was already past, but I'm just curious, I was at home on Shabbos, and my husband was very, very sick. He was coughing up blood, and it was horrible, and he was so sick, and I know he has an illness, but I didn't want to drive him to the hospital on Shabbos. I was really nervous. I'm not sure, though, now if I did the right thing, because now he's really sick. It got a lot worse, and now he's in the hospital. He's been there. Did I do the right thing? So the rabbi's first question that I was listening to, he said, who's your rabbi? And she said, why do you ask? Your rabbi hasn't taught you this? What's the question? You should have rushed into the hospital. So this is the first point, that if someone is in the category of what we call chole sheyesh bo sakana, here, please come sit here, that we do everything we can to save their life. And he goes on, we're just starting this, so I'll summarize in a second. The Shulchan Aruch goes on, kol choli she'aruf omer shu sakana, anytime the doctors say that something is dangerous, afal pishahu ala basar mibachutz, even though it's external, not just an internal, mechalin lavas Shabbos, we'd violate Shabbos to save them. V'im rofa echad omer tzarich, v'rofa achar omer eno tzarich. What if one doctor says they need to be treated, and another one says they don't need? Mechalin. We err on the side of caution, and we would treat them. Yesh vish omer shein tzarich mumcha. You don't even need an expert. Because everyone has a certain ability to be able to determine, at least if something's dangerously ill. More than that, it goes on. What if something takes 8 days to cure, like antibiotics? Should you wait till Saturday night to start it? So you don't do it on Shabbos, that way you only violate one Shabbos? Ein omrim namtimad halayla. Don't say no. Wait till Saturday night. V'nimsa shlo l'chalala v'la Shabbos achas. So only violate one Shabbos. Nope. Start now. If it's someone is dangerously ill, you start right away, and it doesn't matter that there's going to be some chilul Shabbos, because the truth is, as a number of the Meforshim on the Torah say, this is not called chilul Shabbos. Actually, this is called shmiras Shabbos. It's called saving life, and this is what we have to do. And the truth is, even the rabbis and scholars are supposed to do it, as it says in the next source. Mishtadin shelo lasos ayadei enu Yehudi v'kahanim v'nashim ela ayadei Yisraelim gedolim v'bnei das. People shouldn't be afraid to be the ones to save life, and as the Mishnah Berurah says there below, suffix sekanish nefashos. Even if we're not sure, we save life. So we could have a person that's potentially in life-threatening illness. We violate Torah prohibitions, whatever we have to do to save their life. That's the first category, and that's hopefully obvious, right? Let's go to the second category. And then we'll summarize and I'll explain where we're going. So now page 2. Page 2 is a category called Chole She'ein Bo Sakana. What if someone is sick, but they are not in life-threatening danger? Or they're in danger of losing a limb? The Shulchan Aruch writes, Chole She'nafal Machmas Choliav Lemishkav Ve'ein Bo Sakana. If a patient is so sick that they are bedridden, but there's no danger, or their whole body is in pain. It's like a systemic illness, right? Their entire body is incapacitated. Even though they're walking around, that's also considered bedridden. So if a person is so sick that they have to lay in bed, it's not really that sick, but it's pretty sick, right? But they have to lay in bed because of their whole body is sick. The halacha is, the Shulchan Aruch says, Omrim le'enu Yehudi la'asos le'refua. You can ask someone who's not Jewish to do a Torah prohibition for you. Aval ein mechalelin alav es haShabbos b'isur deraisa. But a person would not be allowed to violate a Torah prohibition on Shabbos if there's no life-threatening danger. So they can ask. The reason is because asking someone who's not Jewish is only a rabbinic prohibition. So that's allowed for someone whose life isn't in danger but they're sick. Okay. So far, so good. And then it concludes. The Shulchan Aruch goes through it a little bit. What about if there is a danger to a limb? Afilu yesh bo sakanas aver. Even if it's a sakanas aver, it's in the same category. A person can only violate rabbinic prohibitions to save a limb. As you'll see, if we go through all the sources carefully, today we're out of concern that losing a limb could actually be life-threatening. We treat losing a limb actually as a chole sheyesh bo sakana, as life-threatening, and we would violate Shabbos for it. But technically, the Shulchan Aruch puts it in that category.
Excuse me.
Yeah.
Rabbi, is there levels of violation of Shabbat? Meaning, to give someone some medicine is different than driving them to a hospital.
Right.
Is that or they're all the same? If you evaluate, if you do something wrong, you can do everything wrong, or you try to go slowly.
No, right, good question. We always believe in trying to violate as little as possible.
Okay.
If it's to save life, we don't stop at all.
You go full
But
force.
if it's not saving a life, then we try to say hakal kal tchila. We do the minimal prohibition necessary.
Mm-hmm.
So we learn from what you're allowed to violate how seriously we treat it. So if someone is sick, but their life's in no danger, we can't violate Torah prohibitions for them, but there's a lot that we can still do. So for example, in the hospital, people are at the very least chole she'ein bo sakana. I always tell people when they ask me, like, what do I do about the call button and things like that? So I tell them, really, you're allowed to ask someone who's not Jewish to do anything, first of all, in terms of the nurses or whatever. You can ask them anything. We don't have to hint or anything like that. You ask them straight out. And other things, we try to use like a shinui. So we push the call button with the back of your thumb. You know what they have at Weiner Yeshua in Bnei Brak? I once spent a day at Weiner Yeshua. It's like the Haredi. It's not like it is the Haredi hospital in Israel. So they don't want to push anything electric, and they don't want to make sounds. Hashema Askol, they don't want to make sounds on Shabbos. So their call buttons for the nurses are hydraulic. Is that the word? Hydraulic, where it's air powered. Yeah. So you push a button, it pushes air, and then outside of your door there's a light that's already on, but it's covered by like a metal cover, like a Shabbos lamp, and the air just turns the cover to expose the light. And then there's another place at the nurse's station where there's a bell ringing constantly the whole Shabbos, but it has a steel plate covering it, and it just lifts the plate for a second so that you can hear the bell. But the bell didn't cause because of you, it just lifted the plate to allow the sound to travel. It's awesome. So, anyways, yeah.
So if it's, what is it, Chalei She'ein Bo Sakana,
Yeah.
you live in a ghetto, maybe it's called Pico Robertson or something like that,
Yeah.
and
You can't find
feel
those not
that
Jewish?
your spouse needs to go, he feels he needs to go to the hospital, you feel he does. You call a taxi on Shabbos?
Yeah. So one of the great things is that
But
you
the
can make the
impulse is
assumption that
fine.
most cab drivers are not going to be Jewish. So if we say you can violate a rabbinic prohibition, being driven by someone who's not Jewish on Shabbos is only a rabbinic prohibition.
But I'm calling them.
Also rabbinic. It's the electricity from using a phone. It doesn't cause any incandescent lights to light up or anything. Even better is to use Uber, because then you don't really have to use money directly, and it's probably the best solution. Yeah,
If you're in the hospital, by definition, it's not Chol She'esh Bo Sakana, kind of?
it might be. It's at the least Chol She'ein Bo Sakana, but it's a good chance it's
But
Chol
I'm saying
She'esh Bo
She'esh
Sakana.
Bo. Why else would you be in the hospital?
Most likely.
Yeah.
But sometimes the person is under observation or something, or they're in rehab, or there could be many situations where someone's not in life-threatening danger in the hospital. But we always err, as we saw before, if there's any doubt, on the side of caution, and therefore they would be able to. Yeah, so we frequently encourage people, don't worry, don't ask.
Don't worry about
Your focus now is v'nishmartem me'od nafshosechem, protect your health, and that's the focus now, right? Yeah. So in the second category, we treat someone who's in systemic illness or has to lay down because of their pain as a chol she'ein bo sakana. We can violate rabbinic prohibitions for their sake, but not Torah prohibitions. Okay, I think the last Mishnah Berurah there is important. He summarizes the whole thing here. He says, Hainu, at the bottom of page 2, Shemutter la'asos afilu kol shvusim, you can do any rabbinic prohibition, v'rak al yidei shinui, through a shinui, some kind of awkward manner. Im huchola kol aguf, ve'ein bo sakanas aver, ve'im yesh bo sakanas aver, and if there's a threat to a limb, the Mishnah Berurah concludes, ein tzarich shinui klal, v'kein pasak hataz. That we actually don't need a shinui when it comes to someone's a threat to a limb. Yeah, so that's category number 2. So we have category number 1. If someone's in life-threatening danger, even potentially or maybe life-threatening danger, you can do anything for them. If someone is certainly not in life-threatening danger, but they have to lay down because of their illness, or their whole body's in pain, they're in severe illness, but not life-threatening in any way, then you can only do something that would be a rabbinic prohibition for them on Shabbos. The next category down is called mechush, a minor ailment. Minor ailment, this is on page 3. Mishi yesh lo mechush ba'alma, see there in the middle, vu mischazik holech kabari. Someone has some pain, they have an ache, but they're walking around like they're fine. I don't know, they have a cold, they have they cut their nail too short, their nail's hurting them, it's annoying, it's painful, but they're fine, basically fine. They have some pain, but it's not like a big deal. They can kind of basically go around their daily life, even though it's annoying and it hurts them, right? So this is called the mechush ba'alma, and asur la'asos lo shum refuah. He actually can't do any refuah for them. That includes Thailand. That's nothing. There's nothing you're supposed to do for them on Shabbos in terms of medication. Why? V'filo al yadeinu Yehudi, even if it's not someone's not Jewish is helping you. Gezer mishum zchikas hamamanim, because of the concern that you're going to come to grind pills or whatever, grind herbs. That's the lowest. That's the lowest category, and that's the person that we don't violate Shabbos in any way for even rabbinic prohibitions, as the Mishnah Berurah then says. So now we have 3 categories. Let's take it a little step further, and then we're going to start to jump into the pain issue. Yes.
So let's say you're the third category,
Yeah.
which is male, not female,
Okay.
and the minion needs you. Are you allowed to take a pain pill?
The what needs you?
The
Minion?
minion.
I don't think so.
No.
No. Because you could do it. You could really do it. You're not in that much pain. So this is a mechush ba'alma. We don't allow it. Basically, we're not very lenient when it comes to this. We'll come back to this. Don't worry. Okay, so next we have Makkah Shel Halal. Dr. Marcus, you're going to enjoy some of this part.
I'm enjoying this part already.
But some of this part's going to be special for dentists. So the Makkah Shel Halal is an internal illness, internal organs, something internal. So it's just worth looking at this for a minute because we're going to come back to this. So this is just going to be something to store away, this knowledge. Okay? So the Shulchan Aruch then says, Siv Gimel, bottom there, page 3, Kol Makkah Shel Halal Dahainu Miyashinayim Lifnim. Any internal illness, that means from your teeth and in. So your teeth are considered inside your body, right? Because once you pass your lip, that's internal, yeah? V'hashinayim atzman b'chla. That includes your teeth. Mechalalin aleya es hashabbos. Yes, this is good for dentists. You can violate Shabbos for that. That's considered to be more severe. We're more concerned about internal illnesses. We don't know what it is exactly, how dangerous it is. It's more concerning. V'davka shenis kalkel echad me'ha'evarim ha'panimim machmas makkah. But this is only true if one of the internal organs is injured. It's like an organ problem that's hurt because of a makkah, like something. There's some kind of damage. Right? Aval mechushim ein nikrayim makkah. But if it's just like some kind of pain, my stomach is hurting. But that's not considered a makkah. I mean, if I had some kind of like internal bleeding or something, that's where it would rise to the level of internal illness that we would violate Shabbos for on a rabbinic level. Mihu mishe choshesh b'shinav. If someone's worried about their teeth, and they're really worried to get that tooth out, omer le'eno Yehudi lahotzio. They should ask someone who's not Jewish to do it because it's considered to be, it's considered to be chola she'ein bo sakana, right? Of course, you have to ask the dentist. If there's something that was more severe, it could be worse. Or theoretically, I don't know if this is possible, but if the dentist did something with like a shinui, I don't know if that's even possible. That's probably dangerous. But it's considered to be that you wouldn't violate Torah prohibitions for the tooth. We're going to come back to this, but that's step number 1. Now we go to page 4. You'll see we're going to building up towards something here. Then the Shulchan Aruch says, Makkah shel halal eino tricha omeid. Once we're talking about internal illnesses, we don't really need an expert though to determine the level of pain there. Shafilo ein sham bekin. Even if we don't have experts, the chola eino omer klum, and the chola says nothing. Osim lo kol sheragilim lasos lo b'chol. What we are allowed to do for them, the rule is, for Makkah shel halal, we say whatever we would do for them during the week, we could do for them on Shabbos. So if you have someone who's at work on a Wednesday, and if they have some kind of a pain, they would say, you know what, I'm leaving work. I need to go to urgent medical care or something like that. This is the level where I would seek treatment today. I wouldn't wait till tomorrow. So if it's on Shabbos, they could also seek treatment on Shabbos. We have, if they wouldn't though, if they would normally wait, then they have to wait on Shabbos as well. But if we know they would normally wait, and they don't really need to violate Shabbos, then asur lechalal alav afa pishahi makkah shel halal. So makkah shel halal, we determine what would you do at this level during the week, and we have to see each case by case. Generally, we treat it as you see, as chola she'ein bo sakana, but we watch and see, well, how bad is it? And we have to determine, where it's going to rise or fall to.
Are these halachas, well, I'm a little confused. Is this on the patient or is this on the doctor?
Everyone. Both.
In other words, does the patient have to think, well, I'm a makkah shel halal, or I'm not really, or I am, or?
Well,
you have to think of that.
Yeah.
Okay. And then the doctor has to think, does he need it or doesn't need it? Or?
Yeah. Technically.
So it's on both.
Yeah. Yes.
Does it also depend upon those around who are observing? And, what's pain to one person may not be pain to another. Some people have
but it's based on that person. Yes, good point. That's one of the points he's making here, based on that person. In fact, look, I think it's this next sifhei here. If it's not shel halal, if it's external, you ask an expert and the patient. What level is this? What could happen? Unless one of them has to say, either the expert or the patient has to say, you know what, I know this level of pain, I need to treat it. Or if there's any threat to life, then you just have to do it. But it is kind of based on what an expert says and also what the person says. And if even one of them feels this is something that needs to be treated, then we would treat it. If it's not life-threatening, with rabbinic prohibitions. If it's life-threatening, with even violating Torah prohibitions. And that's really what it summarizes in these last sources here. I just underlined one of them. He says, if it's a lot of pain, then you certainly could treat it, but in the category of chola she'ein bo sakana. So I actually put here, this is actually from one of my books on page 5, summary of everything we just did. So we'll all be on the same page, literally, page 5. And then I want to start really, that was all background. I just felt like we needed that background in order to do the analysis that we're about to do, which will be quick, but I think nuanced and a little bit new also. So I'm going to really anticipate your feedback. But the basic outline, I think I've kind of summarized it a few times already, but you have it in front of you. But we basically have this approach one last time. Chol sheyesh bo sakana, do anything. They're life-threatening, even potentially, do everything. If it's limb-threatening, potentially it could rise in that category as well. But the next category down is chol she'ein bo sakana. We call that incapacitating illness, bedridden, or total body illness, not functioning well, but not life-threatening. For such a person, you could ask someone who's not Jewish, even to violate a Torah prohibition for you, or a Jewish person could violate a rabbinic prohibition. Sometimes that would mean violating something by using a shinui. And they can take medicine as normal. Then the lowest category is a miksat choli or mitzar harbi, also called mechush ba'alma, for whom we can violate no prohibitions on Shabbos for such a person. The question we have to ask now, now we can start our shir. Don't worry, we're just starting now, but it's going to be only a half-hour shir. So. Starting now, though. Starting now, right? So how do we categorize? This is really the question, and I've been asked this question a number of times, and I never gave it the proper thought, to be honest, until this week when I decided to give this shir on this topic, and I decided to really think through it a little bit better. So what category do we put the person who is suffering from chronic pain? Because remember, it's chronic pain. It's not life-threatening per se. It's not that they have an illness, not they have some infection that's spreading. If they don't treat it, it's going to spread to their whole body, and you have to treat it. They have a nerve, some kind of a problem that's a pain issue, and it's not life-threatening necessarily. The only treatment for it is to relieve the pain, whether it's through different types of opioids or narcotics or different types of medications, fentanyl or morphine or whatever. I'm not an expert in this, but but the drugs that are meant to just help us deal with the pain, but not to cure the illness. What category do we put that patient in? Anyone want to just throw out a guess based on what we've learned so far? Their life is not threatened. Yeah, what were you going to say? Yeah, so I think it's obvious. It seems obvious that it's chole she'ein bo sakana. On the one hand, it's a chole. They are sick. I mean, this is a bodily illness. It's something that you have to lay down for. We're going to treat it as a chole. But I think normally you would say it has to be chole she'ein bo sakana. And in fact, I did a little research, just like some Googling and reading some articles, and I found this article by Rabbi David Heber from the Star K online, where he lists all the different examples of what goes into which category. And when he lists his example of chole she'ein bo sakana, some of the examples he gives is one who is experiencing symptoms of the flu, one who suffers from chronic debilitating arthritis pain, one who suffers from migraine headaches or mild depression. And I looked in a book that I have at home called Halachos of Refuah by Rav Pinchas Bodner, a classic work, an important postlaker wrote it, and he writes there on page 56 that to cure the illness as well as to relieve pain from the illness, relieving pain is chole she'ein bo sakana, and in fact he categorizes arthritis as mechush ba'alma, not even as a chole she'ein bo sakana. So that's what he writes in that book. Yes.
The one aspect to this is the severity of that pain. I understand.
Well, yes. Okay, fine.
Because pain can vary so much.
Right.
And I understand that it may not be life-threatening, but it could be so excruciating.
Right. Okay. So you'd want to make the argument that theoretically there could be pain bad enough.
It depends upon the severity.
Yeah. Okay. Yeah.
Isn't this flu business? I mean, people are dying of flu nowadays.
Yeah. Well,
it's changed maybe now a little bit or something.
Yeah.
I mean, there's flus that kill you.
Right. That's true. That is true. You're right. So
that might be very well stuck on it.
Yeah.
Just
see, the way I think he might have written it like this intentionally, because he didn't write the flu. He wrote one who is experiencing symptoms of the flu. So maybe he's referring to someone
Like
who's
you have a
not
cold or
diagnosed. No,
something.
yeah, they're like,
It's
you know,
cold, yeah.
some of those are symptoms, but it's not full-blown flu, because probably you can infer from the way he wrote that maybe full-blown flu could actually be chol sheyesh bo sakana. It's true, people do die, especially if they're elderly or they're already otherwise compromised.
We see them.
Yeah,
You said, it says they're flu symptoms.
yeah,
And one of the symptoms, if you really have flu, not a cold,
yeah,
is, aside from fever, is you have, your body aches
uh-huh,
and is pain
Right.
all over. That's
Right.
one of the distinguishing
Yes.
things that they usually say.
yes, and that's why I thought this was
flu.
relevant for the pain discussion. Exactly. Did you have a comment or question?
Yeah, I mean, one thing I was thinking, I mean, I guess it wasn't so clear to me as far as that it was chola shein bo sakana. I was thinking possibly sakanat ever, just in depending again on the severity. So if you had someone who had a chronic thing like bipolar disorder and they had to take lithium, I mean, kind of maintaining it with that baseline versus kind of going a manic episode where it would be a dramatic shift and potentially, you know, could have catastrophic.
Yeah, yeah, interesting.
I can't remember who I asked. It could have been Zev Weiner, because one time we talked about opioids. I said, well, how
Yes,
do
that's right. I
people
remember.
start on opioids? And he said, well, he mentioned arthritis.
Uh-huh.
I'm not sure it was him, but whoever I talked to.
I remember him once giving me a share on that. Yeah. Uh-huh. Interesting. Okay, so we're going to get more into this, but interesting points. Yeah.
So also he says mild depression. So would a more severe depression put it into the chola sheyesh bo sakana?
Could be, especially if someone's suicidal in any way. Yeah. Yes. Dr. Steinberg wrote in his most recent work, Sefer HaRefuah K'Halacha, he writes here in the bold there in the middle, Mishasova meka'evim chazakim, someone dealing with severe pain. She'ekev kachu ne'elatz lishkav v'mita, they have to lay in bed because of the pain. They're bedridden, or shekol gufu nechlash, their whole body's weak. Mutar lekachas trufot la'argat ha'ka'ev, they can take medication to relieve the pain. V'maka'ev chazak hu pnimi, if it's internal pain, or be'aver sheneshama teluya bo, or one of the internal organs, a vital organ, dino kechola she'ein bo sakana. Even so, seva chazak, he's saying severe pain. Umutar lekachat trufot l'shikuch haka'ev af kishabarur she'ein b'ka'ev hazeh shum sakana. We know there's no sakana, but we consider this person to be chola she'ein bo sakana, and we can violate rabbinic prohibitions. So that, I think, is the standard approach. I appreciate some of the nuance that you brought out in your comments. I think the standard approach, and when I was first asked this question by someone, a pain specialist who wanted to know if he could drive on Shabbos, he had to go his office was 12 miles away, and he's the specialist, only one that could treat in his town this illness. My initial thought was, it's chola she'ein bo sakana, and therefore he can't drive, though if it's really necessary, could take an Uber, but could not drive. And then in fact, I asked Rabbi Sauer, I got the same answer, and then I researched it, and this is basically what everyone's saying. But upon further reflection, and some pushback from some specialists who deal with pain, and recognition of how severe chronic illness can be, and how debilitating it can be, I just wanted to look into it a little bit more. And I was just been like kind of looking around, and just wherever I could find one source, what's another source, and one tshuva, what's another tshuva, and I came across the following tshuva of the Tzitzi Eliezer, which I think is worthwhile to read. And we'll conclude with these last three sources that I want to share with you, and then see if we can possibly use those three sources to make a different argument. So listen to this. This is very, very profound what he writes. The Tzitzi Eliezer on the bottom of page 6 was asked a different kind of question. His question was about hospice, palliative care, end of life. Is it permissible to use morphine, even in dosages that could potentially, theoretically, shorten someone's life, but for the sake of pain management? So he starts to build a perspective, and that perspective will take us somewhere else. So look what he writes here on page 6. It's very powerful. He says, it's a different question, I recognize, but it's relevant. He says, any type of medication, whether it's pills or IV lines, it's allowed to give to patients anything that's for the sake of relieving pain. Valulim gam lekariv yoteres misaso, even if it could potentially shorten their life. It could bring them close to their death. Why? Because this is part of the permission that doctors were given to heal. Relieving pain is also healing. Even though it's not healing, it's not curing necessarily, but it's part of what medicine is for. Why? How do we know this? The Ramban in Torah Sa'adam Sarasakana says, "The davar nesinas harashus she'atzricha ator letetu mipnei she'ein lacha refuas elasakana." Refuah is dangerous. All medicine, virtually all medicine, is inflicting some kind of danger on a person, but it's danger for the sake of helping them, right? Mashemar pelazeh memis lazeh, and what might cure one person could kill someone else. Vim kain hachaname b'nesias zrikas morphine. So too, giving morphine, a kadoma, or something like that. Hagam shezeh ba ach v'rak kedei lahashkit as yisurim. Even though this is given only to relieve the pain, mikol makom nir degam ke b'chal kedei l'rapasu. That's considered healing. That's part of refuah. Even if it's just healing, relieving pain, that's refuah. That's medicine. This is what I underlined. I found this to be a very profound line. Ein lacha davar shekasha la'adam. There's nothing as difficult to a person, v'sevelo rav yoter mi yisurin, more difficult or painful than pain. Habayim alav lo'olim, that comes to a person. Physical pain can be one of the worst things possible. A person can't function, they can't be themselves, they can't focus. L'chein kishenostim lo davar kedei lahashkit az yisurav. Therefore, to give someone something to relieve their pain, Zeu be'atzmo nikra nesinas refuah l'rapos l'hashkit yisurav. That's considered to be refuah. So that's point number 1. Now he's going to go a step deeper. Page 7. Then he says, Upuk chazi bechazal. And this I thought was totally brilliant and fascinating. Look at what the rabbis wrote in the Talmud. In Kesubos, Be'od Kama Makomos, in many places, Ilmale nigdavu lechananya mishal v'zaria palchet litzalma. Let me explain what this is. I'll explain it outside, though the piece of the Talmud is all here below on page 7. Hananiah, Mishael, and Azariah were 3 Jews who Nebuchadnezzar brought with Daniel to Babylon. And they were like kind of court Jews. They lived in the court. If you remember the story, they ate only vegan because they were keeping kosher. And Nebuchadnezzar was kind of he was a little bit of a self-centered ruler. He was an evil person. Nebuchadnezzar destroyed the Beis Hamikdash, but he was also a little bit of how would you say it? A narcissist. Is that what you said? Sadist, narcissist, both. Yeah. At one point, he built a 60 amos tall golden statue of himself. 60 amos tall. That's tall. Yeah, of himself. And not only did he build it of himself, golden statue, everyone had to gather around. They had a huge orchestra, and everyone had to bow down. Would you feel comfortable bowing down to a golden statue of a leader? So Hananiah, Mishael, and Azariah didn't do it. They didn't bow. And they would have gotten away with it if it wasn't for some Chaldeans. The Chaldeans went to Nebuchadnezzar and they said, there's 3 Jews in that crowd. They have their own rules, their own religion. It sound familiar at all? They're different than us. And they didn't bow down. You should punish them. So Nebuchadnezzar says, oh, that's horrible. I can't believe they did that. Start the fires. They lit the fires. He turned the fires. He had them burn them 7 times harder than normal. So hot that the people stoking the flames actually died because it was so hot. And then he said, okay, take them and throw them in. And Hananiah, Mishael, and Azariah said, okay, we'll go because we're not going to bow down to the idol. So if that's a threat, we're not scared. And they went, jumped in the flames. The story goes that they were just walking around the flames saying, oh, you think this hurts us? We're fine. And then he was like shocked, pulled them out, and he basically was like, oh, who's your God? I believe in your God. They survived. But what does the Gemara say here? That was because they were willing to jump into fire rather than worship an idol. That's gewaldic, beautiful. But the Gemara says, if they would have lashed them, that's what the Gemara says here. You can read the whole thing there, put it in English also. If they would have given them lashes, makos, you would not have been able to blame them for not jumping in, for rather bowing down. They would have said, I can't take this, I'm going to bow down. Because, he quotes this here in the Shita Mekubetzes, the pain of lashes is worse than the pain of being burnt alive. Because the pain of being burnt alive, he argues, whatever the mitzios of the reality is, let's just take the argument, because it's a brilliant, creative argument. The pain of being burnt alive is you jump in and you're dead. It's kind of like, theoretically, probably worse, but like, a quick shot in the head or something. It's obviously a little worse than that. but the pain of being lashed, being lashed over and over with time in between, the tremendous pain is something that most people would not be able to withstand. So he says we would not have judged Hanani, Mishael, and Azariah if they would have bowed to the idol rather than being hit by the lashes. That's what the Gemara says. That's just that. So look at what he does with it. I think this is brilliant. So then he goes on to there. He says, Ki lo hayu yichon la'amod b'koved Yisrael. They wouldn't have been able to deal with that kind of pain. But Tosfos yesterday, Rishonim danim harbe bezeh, and other Rishonim discuss this. Eich sheyuchlu al pidin lemiflach letzalma. Wait a second. How could they have been allowed to bow to an idol? Zeh becho. Everyone gives a different answer. Shita Mekubetzes says, what's the Shita Mekubetzes answer? That being hit by something that's there's no limit to that pain. It's not defined. It's not immediate only. Yoser chamira yoser mimalkos umisa. That's worse than just malkos, and that's worse even than death. Horrible pain is worse than death. And then he goes on to say, look at what the Beis Yosef and the Torah says. There's a discussion. We don't allow suicide in Judaism. Suicide's not allowed. But there is a discussion in the Beis Yosef. If there could ever be a time that we could justify someone killing themselves, because someone is going to torture them, so someone says, I'd rather die than be tortured. I guess it's kind of like Masada in a way. But the real example is Shaul HaMelech. The Plishtim are coming to get him. He knows he's the king of Israel. They're going to torture him. They're going to make a mockery of him. So he falls on his sword and kills himself. And the rabbis don't necessarily say it's a good thing what he did, but they say it's understandable. We get it why he did that. And we can even maybe be justified. They try to find justification. Why? To avoid pain. Pain can be so bad that we can justify it's in some ways worse than death. These sources are arguing, right? And not just that, or the Shema lo yuchlo lamod b'nesayin, or maybe they wouldn't have been able to withstand. And what could happen? The pain could make a person go crazy, v'al das kono, or rebel against God. Chas v'shalom. Pain could lead us out of our mind. So he concludes. This is the second paragraph there now. As I said before, pain is worse than a standard, illness, and therefore it's considered part of the healing process. Yeah.
This is in part almost a justification of hospice.
Yeah, that's one, not just in part. This is what he wrote this tshuva about.
Yeah.
This was when hospice was new, and he was permitting hospice. Exactly. But I think you could take it even maybe further. He's talking about how severe we treat pain in halacha. That it's really, treating pain is healing, even though it's not actually curing the illness, but that's part of what a doctor's role is, to treat pain. And that suffering, to tremendous pain and suffering, is considered almost as bad, or actually in some ways worse than death, such that we can justify someone theoretically, bowing down to an idol rather than suffering severe pain, killing themselves rather than suffering severe pain. It's a tremendous level of regard that the rabbis have for the severity of serious pain. And so that leads us to the final, where I want to conclude, and a possibility of going further with this, which leads us to page 8, the last page. And this I found quoted it's the very, very, very bottom of page 7, and then page 8. So page 7 just gives you the source. It's Shevet HaLevi, Rav Vosner. That was the leading Hasidic rabbi of the last generation. He just died recently from Bnei Brak. He has almost this exact question that I started out with. Look at the question. He is asked, V'asher shalatam be'isha sheyesh la machla she'en refuah la. There's a woman with a terminal illness, incurable. V'noda la b'Shabbos yisurin shelo haisa yechol lisavlam. And on Shabbos, she developed pain that was so horrible she couldn't bear the pain. But there wasn't a cure for it, right? She was just in horrible pain. Uba'ala kara l'rofeh. So her husband called for a doctor, violating the Torah, right? Having the doctor drive to him. V'yesh safek imasa kedin. And then afterwards he felt, I don't know if that was the right thing. I called the ambulance, I called the doctor to rush to my house, but maybe that wasn't right. She couldn't be cured. So now he's feeling guilty, right? You can imagine this fellow in Bnei Brak is feeling a little bit, I don't know if I did the right thing. She'ein l'rofe shum refuah lamachlasa. The doctor couldn't cure her, so why? Maybe I should have just told her, stick it out. Just wait till Saturday night. V'ragnosein trufot lahashkit rucha shlo tavoli deyush. He was just giving her some medicines to, help her feel comfortable. So the Shevet HaLevi answers to him, Pashut me'od, she'ein kan chilul Shabbos. It's simple and obvious that this was not a violation of Shabbos. Kivan shekanira, mikosin mechtavo, as I see from what you're writing, maka shel chalalhi. Here's avenue number 1 for leniency. This is considered a maka shel halal, which makes sense. It's an internal illness, right? So what did we say about maka shel halal? How do we judge the level of what you can do? Remember the rule? Remember? There was a lot of rules we learned tonight.
Well, he said one rule. What would they do if it wasn't Shabbos?
Exactly.
I think that's a wonderful guideline.
That's the guideline. What would you do if it wasn't Shabbos? So he writes here, maka shel halal hi v'hainu chol shel sakana, right? And then he quotes the sources here, right? Perish shegam devarim she'enam la'etzem refuas hamachla ela kol harogel la'asos bechol. Whatever you do during the week, osim gam b'Shabbos. You could do on Shabbos v'karov lishmo shegam achokim. And there's some who disagree with this, right? He mentions there's some who disagree with this, but even them modim kan, they would agree here. But right? Some disagree that you can do on the Shabbos what you would do on a weekday, but they would agree here. That in this case, that medication to relieve the pain of the chola of the patient, right? They would even agree in this case you could do it on Shabbos to relieve their pain. That's avenue number 1 he takes. Then he takes another avenue, and he says also, Od the pshita de kaigavna lo garam yisuve daita. There's a category in halacha of yishuv hadas, yisuve daita, tiruf hadas. Tiruf hadas means acute mental anguish. Yisuve daita. The classic example the Talmud gives is a woman in childbirth who's having difficult childbirth and it's dark. You can light a fire, you can light a candle. The candle's not going to help necessarily the childbirth. It's just going to make her comfortable that everyone can see, and it'll be better. Like it makes her feel at ease. Okay, I can see what's happening, just to relieve the emotional distress, even if she's blind.
Wow. Because
she's at least happy to know that other people can see, and you're allowed to light the candle. Everyone else can say, "No, I can see fine. It's okay." But she said, "No, please, just light the candle." So you know what? If you're that afraid, we could violate Shabbos. Lighting a candle obviously is an issur deraisa. Lighting fire on Shabbos, havara, but you can do it for yishuv hadas, yisuv daita. So he says also, if a person's in severe pain and that pain is like driving them crazy, I don't know if that's really the right word to use, but they're just making them lose their mind. I can't bear it anymore. I'm so afraid, and they're getting all kind of so ill at ease. So that could be in this category, right? So he concludes there. Second to the last line, this is for sure not less than Yishuv Hadas, that you're allowed to light a candle for, or the chos, or burn out the candle for. There's nothing that calms a person down more than actually giving them medicine to calm them down. If you can turn on a candle to calm someone down, you can give them drugs to calm them down, right? Medications. So he says, for sure, for 2 reasons, he says to the husband, don't worry. By calling the doctor to treat her pain, you did nothing wrong. In fact, it's pashut meod, it's obvious. And then one last, and then we'll discuss, and we'll conclude with this. One last source that I found also in the Shmir Shabbos. Shmir Shabbos doesn't mention it up top in the main part, but he has a footnote of what Rosh Zalman Auerbach told him about our case as well. He says here, Shemati me'agon Rosh Zalman Auerbach zatzal de bezrikas morphine, she'ena ba el hargia ve'ena berfua. It just comes to calm someone down, not to heal them. Nira lecharish azay dom lekira shein. This should be like pulling the tooth. Al Yidei Yisrael, as we learned before, which we said was chole she'ein bo sakana. You can only do a rabbinic prohibition for. That's what it should be. She asur mipnei she'ena refua. You do it. It's not a certain cure. V'imkein lechora gam ein lechal es Shabbos tzorich zrikas morphine. So too it seems you shouldn't violate Shabbos deraisa for morphine, just like we said at first. But then he says, afa pikein yesh makom lomar shemutar lachala bazeh. There is a way. He gives a different way than what Rav Weiner says. There is a way to say that maybe it could be allowed. How could you say that? Sharigam ke'evim alulim l'sakein chaye adam. Also, besides what Rav Weiner said, theoretically, horrific pain could danger someone's life. even though it's not the illness itself, but the horrific pain, theoretically could be pikuach nefesh. Someone could theoretically die from being in horrific, intractable pain. Ulachem estaber shekol hargas ka'evim yeshbo mishum safek hatzala shel chaye shah. You could say that, and remember, when it comes to saving your life, we say even doubtful, even a safek, we err on the side of caution. So he's saying you could argue in some cases that it is potentially life-threatening, and if it's potentially, possibly, maybe life-threatening, you can do what you need to relieve the pain. So I'll just summarize, but then I want to hear your reactions. So in summary, it seems obvious, as we reviewed the sources, that severe pain is cholet she'ein bo sakana. They're not going to die from it. They're falling in bed because of it. Fits the category exactly, and therefore we can only do rabbinic prohibitions for them. But we see, when we look a little deeper, that there is a tremendous acknowledgement in the rabbinic sources about the severity and the impact of severe pain, and that it can be considered to be worse than death in a way, and we can justify horrific things because of avoidance of pain or because of pain, and therefore we have three routes of heter. One is assuming that it's a makah shel halal, it's an internal wound, and such a case could be, according to some, treated as you would treat it on the weekday. And if someone's in bad enough pain that they wouldn't just say stay at work, but they would really treat it, maybe you could treat that, or to calm someone down. We know that we can violate Torah prohibitions to calm someone down, or maybe it could even be considered pikuach nefesh, life-threatening. And so even though there's a standard approach, what I shared at first, I think now we see that there is room for being even more lenient. It depends on what you want to say, lenient or machmer. Maybe we're being machmer in pikuach nefesh, but even more understanding, and there's maybe more wiggle room than we thought when it comes to treating severe pain.
I was just thinking, if you